Hello, I'm Dr. Mao. Welcome to the weekly Dollar Wellness COVID update. I, along with my colleagues, will give you the latest development in COVID 19 and some practical advice to help keep you healthy and stay out of the ER. Let's start with some good news. The US is recording 53,700 daily new cases on average over the last week, an 18% decrease from the average 2 weeks ago. And the not so good news: despite the decline in new cases for the country as a whole, new deaths are likely to continue to rise over the next 2 to 3 weeks, as deaths are a lagging indicator to the spike in cases we saw back then. On the vaccine development front, with the aid of technology today, scientists are delivering genetic material into the body's cells, turning them into vaccine factories and skipping time-consuming steps of growing the whole virus in eggs, for example. There seems to be a race out there. Russia just announced that it has developed and approved the first COVID-19 vaccine. China and UK are not far behind. There are over 170 vaccines in development around the world, 7 of which are in phase 3 trial. Some countries are not waiting to finish phase 3 trial for safety and will start vaccinating high-risk populations and soldiers. And that is the kicker. Will the vaccine that are ultimately offered be safe? We will keep you up to date on these developments. Today, let's talk about some of the patients we've been treating after recovering from the coronavirus. Many of these patients have been complaining of brain fog, anxiety, and depression. According to preliminary studies, as many as 1 in 3 patients recovering from COVID-19 could experience neurological or psychological after effects of their infections. Now, these problems range from headaches, dizziness, and lingering loss of smell or taste to mood disorders and cognitive impairment. According to Theodore Postolash, professor of psychiatry at the University of Maryland School of Medicine, quote, perhaps between 30 to 50% of people with COVID infections that has clinical manifestations are going to have some form of mental health issues. That could be anxiety or depression, but also non-specific symptoms that include fatigue, sleep, and waking abnormalities, a general sense of not being at your best, not being fully recovered in terms of the abilities of performing academically, occupationally, and potentially physically, end quote. The good news is that we've seen improvements with our patients recovering from COVID, with their memory and focus getting better, as well as their anxiety and mood. In addition, I'm happy to report that with acupuncture, some patients' smell and taste have returned also. Studies show that acupuncture and herbal therapy, along with Qigong and Tai Chi, may improve cognitive function and regulate mood. Here is a simple practice you can do at home to stimulate your acupoints and help with your recovery. Simply tap the 3 energy centers we call dantian in your forehead, sternum, and 3 inches below your belly button. Take your index and middle fingers and tap the acupoints in your forehead 21 times. Then move on to the sternum right in the middle of your chest. And finally, tap 21 times about 3 inches below your belly button in the abdomen. Each of these corresponds to an endocrine gland. For example, the pituitary and pineal gland in the forehead, thymus in the chest, and adrenal gland in the abdomen. Repeat 3 times daily and do it for a few weeks until you feel better. In summary, while the case numbers trends in the U.S. looks encouraging and the vaccine developments appear promising, the most important thing we can do is that we all need to do our part to lower the numbers. And if you or your loved ones are recovering from COVID-19 infection and experiencing neurological and psychological impacts, get help by contacting a reputable, licensed doctor of acupuncture and Chinese medicine and try the self-healing practice I just shared. Until next week, please be safe by wearing your mask in public, washing hands often, and take care of your loved ones by taking care of yourself.